Our group looked at shoulder injuries in overhead athletes. I'm Frank.
I'm Mark.
My name's Enrique.
I'm Tobias.
And my name's Chris.
So I'm going to start with an introduction. Injuries among overhead athletes have a high rate of occurrence. However, not much research has studied how to prevent them. Research has been done to better understand the nature and severity of injuries to overhead athletes and what range of motion and or biomechanical deficits may be present after injury. The clinical question we came up with were, are there risk factors in overhead athletes that are strong predictors of shoulder injuries?
Some of the risk factors that we identified was strength in the shoulder for internal and external rotation, endurance in the shoulder as well for both ranges of motion, asymmetrical range of motion discrepancy, and humeral retrotorsion. Our definition of shoulder injuries is any painful manifestation due to overuse or traumatic mechanism.
So the first risk factor was range of motion, and we looked at internal to external rotation of the upper extremities bilaterally. And we found that across several studies that an asymmetry between dominant to non-dominant hands, 5 or greater degrees of total range of motion doubled the likelihood for injury, while 13 degrees increased the factor by 6.
Risk factor strength, we looked at 2 systematic reviews, and they found that low external and internal strength, low supraspinatus strength, and low external to internal ratio and endurance were all risk factors in overhead athletes.
And the third risk factor was humeral retrotorsion. And the purpose of that study was to determine if humeral retrotorsion had an effect on shoulder injuries in overhead athletes. Some of the main findings were the degree and direction of the humeral retrotorsion had an effect on injuries is unknown. It's also multifactorial and player-specific, and consistent findings among studies and varying effect sizes. We do suggest to include humeral retrotorsion when evaluating overhead athletes.
So in conclusion, the research suggests that not one biomechanical factor, such as strength, range of motion, or humeral retrotorsion can alone predict the likelihood of injury. However, we do consider that you look at all these factors when screening an athlete, and remembering the rule that 5 or greater degrees of asymmetry, total range of motion from dominant to non-dominant, increases your likelihood of injury by 2, while 13 increases your likelihood of injury by a factor of 6. Also looking at isokinetic dynamometry when possible, external to internal ratios, and endurance when considering likelihood for injury.
And just some considerations for the future. We think that the research can benefit from higher quality randomized controlled trials on injury predictors in overhead athletes. There is also a need for a universal preseason screening tool for shoulders and overhead athletes.
Some major limitations: there is a lack of universal preseason screening tools and an objective measure to correlate to these injuries. There was also a need for more high-quality randomized control trials to identify strong predictors for shoulder injuries in overhead athletes, and more research on if humeral retrotorsion is a likely factor that contributed to injuries in overhead athletes.
And that's it. Thank you.